Today, we are excited to learn from Jules Porciuncula from North Carolina State University's Department of Sociology and Anthropology. She will be presenting content analysis of extension mental health information in the Southern region. This is an examination of how existing sources of information deliver these resources, the subjects and recommendations they discuss, and the populations they address. Before I turn the discussion over, I ask that we all speak in an intentional cadence to permit the interpreters to follow along with the conversation. Also, audience, please place your questions in the Q&A function that you will find in the bottom toolbar in Zoom. We will follow the presentation with time for Q&A, which will also include myself, Dr. Andy Smolsky, from North Carolina State University's Department of Agricultural and Human Sciences, as well as Dr. Michael Schulman in the same department. Now, over to you, Jules.
Thank you, Andy, for that introduction, and thank you for being here. And we're going to get right into it. So like Andy said, the title of our research project is the content analysis of extension mental health information in the Southern region. So the researchers include myself, Dr. Schulman, and Dr. Smolsky, and this work is supported by the Southern Ag Exchange Network from the USDA's National Institute of Food and Agriculture. So any opinions, findings, conclusions, or recommendations expressed in this publication are those of the authors and do not represent any official USDA or US government determination or policy. So let's dive into the background information that informed this research. So next slide, please. Okay. Are the slides good, Andy? I don't know. Went through.
Once you say it, they're moving forward. So
Okay.
don't worry.
Awesome. So there's a growing body of a literature that examines the interventions and online resources directed at improving farm stress. So as a lot of you may know, farmers as an occupational category are at a heightened risk of death by suicide. And a lot of those stressors include finance, weather, occupational demands, physical health, structural changes in the agriculture, and challenges within the family or within the household. So research also shows that the process of navigating stress differs by farm and farmer population characteristics. So that includes race, gender, type of farm, and whether the farmer has access to social support resources. And then other bodies of literature emphasize the role of community in providing social supports. Another broad category of applied research comes from the interventions to reduce farm stress and negative health outcomes. So an example of this would be university-based extension professionals providing training in mental health awareness to farm groups and organizations. So overall, just classifying and identifying types of online information resources that extension provides is really important for understanding what additional materials farmers may need to navigate farm stress. And then the next slide, we'll get into the research objective. So we conducted a web-based search and a content analysis of online materials on mental health and farm stress available on the extension system websites from 13 different states and 2 US territories. And in the next slide, we'll delve into a little bit more about the case. So from June 2023 through August 2023, we searched for farm stress and mental health information on the extension systems websites at these land grant institutions. So that includes the 1862, the 1890, and 1994 land grant institutions in the states of Alabama, Mississippi, Louisiana, Texas, Arkansas, Kentucky, Tennessee, Georgia, Florida, South Carolina, North Carolina, Virginia, and Oklahoma. along with the US territories, the Virgin Islands, and Puerto Rico. So in total, there were 30 extension websites that we searched in this specific region. So onto the methods section, we performed searches on the extension sites in each state or island territory using these following key terms. So we use the key terms mental health, physical health, emotional health, well-being, stress, anxiety, coping, depression, crisis, and suicide, combining that with farm, farmer, farming, agriculture, and rural. So we conducted these searches using the search bar on the CES homepage for each land-grant university. And we also jotted down some field notes to report the experience of conducting these searches on each CES site. Along with building on from the work of Inwood et al., we started with a set of 4 typologies as thematic guides to organize and classify the content of the online extension resources. So moving on to the specific typology, the thematic typology for extension online resources, we first categorize the delivery format of the online resources. So that includes fact sheets, reports, workshop and conference materials, video and audio recordings, web articles, journal articles, and other. The second typology categorized the types of information included in the online resources. So services that have to do with financial matters, legal matters, mental health services, physical health, weather and disaster, and labor. And onto the next slide, we have the third and fourth typology. So the third typology categorized the recommendations for navigating stress. So that included self-help, mediated help services, social support, and additional resources. And then the fourth and final typology categorized the farm population type, which mentioned in the resource that included or were directed to the general farming population and farming population subcategories based on race, ethnicity, gender, or social status. So those were the 4 typologies that we used. And based on identifying emerging themes and then also marking the relevant text, we develop codes within each of these 4 typologies. So during the coding process, we modified and expanded the codes, and then we transferred the coded information into a spreadsheet or database, along with descriptive summaries of each of the collected resources. So on to our findings. We'll go ahead and go to the findings that pertain to the delivery formats for the resources. So in total, we collected 145 information resources that fit the inclusion criteria. And then we classified each online resource into one of 6 categories to distinguish the resource format. So web pages, workshop, conference materials, and journal articles were the most common formats for the online resources available on farmer stress and mental health. So as you can see in the next slide, on table 1 shows this very clearly. So you can see that web pages are the most common formats, followed by workshop, conference materials, and then the journal articles. And in the next set of findings, we identified 6 general categories for the type or subjects of the information included in the online resources. So all of the 145 collected resources offered information on farm stress and mental health, because that was part of our criteria. And then the resources that provided physical health and financial information in addition to mental health were the most common. So information that regarded interventions related to mental health and labor or legal issues related to farm operations were actually the least common in the online farm stress materials. So overall, about 65% of the resources combined mental health information with another subject category of information. So that could be financial or legal services, while only 35% of the resources were only directed at mental health information and services alone. So onto the recommended interventions for navigating stress. So to differentiate the specific type of mental health interventions for farm stress, we used a set of 4 coding categories that build on the definitions from Inwood et al. So that included categories like self-help strategies, mediated help, social support, and additional resources. So about 68% of the farm mental health resources included multiple interventions for navigating stress. So that could be a combination of self-help and mediated help, or all 4, while only 31% of the resources offered a single intervention. And then onto table 2 in the next slide, it displays the number of times each online resource mentioned a specific farm stress intervention. So that includes both single and multiple coded resources. So the most common interventions, as you can see, were self-help and mediated help strategies. So information on interventions that advocate for social support networks was actually less common than self-help practices. And in addition, information on social action and policy changes on an institutional level was rarely mentioned. So anytime institutional change was mentioned, it usually came in the form of additional links that led to external websites. And then the next finding category, we looked at farm population type. So we used a set of categories to identify the farm population types mentioned as either the subjects or the audience in which the online resources were targeted at. So the distinct farm population categories represent the diverse population of farmers. So that's based on social and demographic variables, including race, ethnicity, and gender. We collapsed the original set of 9 categories into 3 categories since some farm population subjects were rarely mentioned in the online materials. And on the table in the next slide, table 3, you can see that a majority of the resources coded focus on mental health recommendations for the general farming population. So that's about 88%. And then only 10% of the collected resources mention both the general farming population and then also a specific social or demographic subset of farmers. And then even less than that, less than 2% of the collected resources directed the information at a single specific subset of the minority farm population. So as you can see, even with multiple coding, there wasn't very many mental health resources that were specifically directed at socially disadvantaged farmers. And finally, we are going to conclude with a few of our findings takeaways. So 15 of the CES sites were found in 12 states. They were available and they offered online mental health or farm stress information resources. So consistent with the work that we based our typology on, consistent with Inwood et al., majority of the online resources were web pages. So according to Inwood et al., fact sheets and web pages can actually be improved by providing links to existing mental health and financial assistance programs and providers. So in our content analysis, most of the online resources actually did include internal and external links to affiliated mental health initiatives, to assistance programs, and additional information on relevant topics. 65% of the online resources were often coded combined with mental health information, along with information on finances, labor, weather, or other possible sources of farm stress. So researchers have found that finances are actually a major concern among farmers, especially regarding farm production. So all in all, the content analysis showed that there wasn't plenty of information related to discrimination, and financial risk, and its contribution to farm stress among Black farmers and minority farm populations. The three most common types of recommendations for mental health interventions were self-help, mediated help, and then links to additional resources. So this really just shows the importance of individual efforts supplemented by guided social supports. And the number of embedded links to additional community mental health resources also highlights the interconnectedness across extension offices and community resources. While on the other hand, the content analysis showed that structural and institutional factors related to farm stress were rarely discussed in detail. And then moving on to the generic farm population, that was mainly the target of these online extension resources. There weren't very many resources directed at providing farm stress mediation for the specific needs of minority farm populations. Other researchers have stressed the need for culturally grounded approaches that really recognize how race, gender, scale of the farm population and operation, and region influences farm stress and mental health resources needed to address it. So we really also want to consider barriers for farm populations in accessing online information and developing digital literacy. So those barriers may include the lack of high-speed and reliable internet in rural areas. And researchers have found that the use of technology and social media are very effective in distributing information and exchanging knowledge among farmers. So proper website development really should involve farmer shared preferences that are related to layout, fonts, language, search ease and efficacy, device compatibility, individual digital literacy, and information delivery. So among the CES websites that we searched, we did find a pattern of issues, including ineffective Boolean searches and functions, along with filter adjustments that may impact the user experience in accessing these mental health resources. So it's really important to carefully evaluate the accessibility of online information and the ease of use with different devices. And lastly, we have a couple limitations and recommendations for future research on the next slide. So our findings are based on a restrictive set of criteria and a limited time frame. So a different set of criteria and search terms would yield a different set of results. So there is a lack of data to explain the patterns regarding expertise with mental health programming, and then also the traditional patterns of individual approaches to farm stress. So in order to address some of the questions raised from our content analysis, we do recommend interviews with extension professionals and also case studies on the development of mental health information and resources. So assessing the efficacy and impact of these farm stress online resources is also beyond the scope of the study. So evaluation studies like longitudinal surveys of farmers, farm mental health professionals, and community members can help to better understand the impact of farmer mental health online materials. And overall, we just encourage the development of systematic approaches to farm stress so that CES agents and educators can focus on the root causes of farm stress by linking these different types of resources and services. And that concludes our content analysis and the findings and limitations and recommendations for future research. And we can open the floor now to some questions if anyone has any.
Um, thank you so much, Jules. I'm gonna stop sharing the screen. And that way, we did have two questions. The first question that we have is I may have misread the slide, but it looked like there were a couple of states in the region that aren't represented in the data. Is there a plan to go back and collect data from those states? Or maybe we could also discuss why those states may not be represented in our data set?
Yeah. Would you like to answer that, Andy?
Yeah, I can definitely provide some context here. So what we found, and I think Jules was really expressing these findings at the end when discussing kind of issues with the Boolean searches, challenges with internet infrastructure, is that the extension websites for 1862s, 1890s, and 1994s are not always interconnected. By that I mean you can have programs that are developing websites that aren't connected to the main extension website. I can give a case example. In North Carolina, the North Carolina Agro-Medicine Institute has a website that is co-developed with Cooperative Extension in the state. If you search for mental health and farm stress resources through North Carolina Cooperative Extension's website, it will not link you through their Boolean search to that website for NC Agro-Medicine Institute. Because of this, resources that may exist or information sources that may exist in certain states did not populate through our systematic procedures. At this time, we do not have a plan to collect data again with these systematic procedures, although it is not out of the realm of possibility that in a few years, this type of process is repeated to see what changes have occurred. That could be one metric as well of measuring the efficacy of the Farm and Ranch Stress Assistance Network and increasing the knowledge base that people can draw upon to address issues of agricultural stress. Jules, do you have anything to add or clarify on that?
All right, just to add and kind of sum it all up, as we mentioned in the findings, takeaway, and discussion and conclusion, we did find just 15 of the CES sites offering mental health online resources, and that was only from 12 states. So we did miss out on 3 of those states and found that there weren't any results generating from those 3 states and 2 US territories for their land grant institutions. And that kind of ties into the other comment or question about data from, or sorry, online resources from the University of Florida. We did also follow up with some universities through email and phone call about developments in their CES sites that are adding in more information for farmer mental health resources. So that is something that we would love to include in our database that we mentioned about creating and adding descriptive summaries on. And Andy or Michael, if you have anything to add too.
Yes, Michael, anything you would like to add to this?
Well, again, the results are based upon, the search terms and that were used, and we certainly didn't use every possible search term in the alphabet that could have identified variety of mental health resources. So again, there could be resources that are out there that are the terms that we used or the websites that we were able to locate, that we missed. We were basically replicating the the study that was done originally on the resources in the Midwest,
Mhm.
you know, and to do it in the Southeast states. So again, the results are contingent on the methods, and the methods have limitations. I think the other issue gets to be what will happen to these results. And I think the issue there is that, you know, for the SAGE resource base, then people who which is being built, right, Andy? I mean, you're building a resource-based directory.
Yes.
So
That's
then,
correct.
you know, if there are resources that this methodology did not identify, then there should be a process for people who have access to, you know, resources that were missed in this type of search to add them to the database.
Mhm.
And who, if they have that, what should they do?
And that is in process. For instance, the resource directory, as distinct from the information sources, there's a submission form. Similarly, a submission form might be necessary for information sources or also contacting representatives of the network.
Okay.
That would be the other, I think, way to get existing information sources into the information repository.
Yeah.
And I know, for instance, so the question from the University of Florida, Jules had followed up with them. We know that they are constructing a website where they're also storing their information. Just sharing that link with Sage once it is ready would be another way for these things to flow into the repository. Are there any other questions? Give it a moment. Let me get to this one. If not, then I would like to thank everybody for their time today. I would like to thank Flora and Felipe for their time and interpretation. It is very much appreciated. The website will have both the English version and the Spanish version so that folks can access these recordings in their language of preference. I'd like to thank Jules for a wonderful presentation, very informative, and also Dr. Schulman for sharing his insights and questions as well. I hope you all have a great rest of your day, and we will see you at the next SAGE Applied Research webinar.
Thank you all for being here, and thank you, Andy, too.